Over the past several months, I've heard from many of my constituents who are very concerned that soon they will have to turn over much of their most private health care information to the IRS as a result of Obamacare. And I certainly believe that their concern is justified. The American people have been jolted really recently by revelations of wrongdoing within the IRS, which has diminished their faith and confidence in this very powerful federal agency. The IRS has admitted that they had singled out specific groups for extra scrutiny simply because of the political beliefs held by those groups. And since these revelations really have come to light, two senior IRS officials have hidden behind the protections of the Fifth Amendment to shield from the American taxpayers, who, by the way, pay their salaries, the facts about their wrongdoing. Giving this discredited government agency even more authority to enact various provisions of the Obamacare law, and giving the IRS more power over our daily lives by putting them at the center of some of the most personal and private decisions made by the American families, I think is simply unacceptable. The American people do not have the necessary faith needed in the IRS to ensure that the agency fairly and prudently enforces this massive takeover of our healthcare system and be entrusted with the unprecedented access to people's most personal healthcare information. I believe that the IRS, through its own actions, quite frankly, has made it clear that it cannot be trusted with this new role. That's why I co-sponsored a very simple two-page bill, H.R. 2900, and the name of the bill is the Keep the IRS Off Your Healthcare Act. Very simple title. And this bill takes away the authority of the Secretary of Treasury to enforce any aspect of Obamacare. So instead of giving the IRS more power and more authority over the American people, this bill takes that power away. And I'm pleased to say that I voted in favor of this important legislation and that it passed the House. And now it's time for the Senate to act and to protect the privacy of every American's private health care information.